other thing that I learned was in the interview, I asked her, so you know, I had to leave shortly after you had felt like you had stabilized her. So how did the rest of the shift go? And she goes, well, you know, we tried to get her up again and the same thing happened. But her vital signs were fine, and so we just laid her back down, let her rest a little while. So the third time, so this is an experienced nurse, right? Doesn't try once and get frustrated as long as she feels the patient stable. Tries a third time, they got her up, and she did fine. So she stayed with that and worked with that. The other thing I asked her was, so did you ever call the physician? Because she had never called the physician during all of this. And she goes, you know, I never felt like I had lost control of the situation, or that with what I was seeing, I could say enough to the physician that there'd be anything that they would give me as an order or whatever. I just knew I needed to keep assessing and putting things together. She goes, the physicians did come by, and after we had tried to get her up the second time, and they asked how she was doing, and I said, well, she's doing pretty good. Tried to get her up, and she kind of, you know, her saturations went down, but she stabilized. Tried to get her up a second time, same thing happened, but everything else is stable. And they said, okay, good job, maybe later. So what that demonstrated for me was, if I hadn't been there watching, if I hadn't been there asking what you were thinking and all that, all the invisible work and decision making and expertise around, is she throwing a clot, isn't she? Do I need to call the physician, or what other things should I be looking at? How do I stabilize her and decide it's okay? All invisible work, exquisite expertise with an eventual outcome. The patient gets up, discharged, you know, on a next couple days with no complications. So that case in itself demonstrated several things. The thinking, that's the core of everything, the invisibility of it, and the expertise. I'm not sure that a brand new nurse on several levels, just from interviewing them and knowing the task orientation, I'm not sure they would have stopped getting the person up and enough to notice. Now, if she wasn't throwing a clot, they could have gotten her up. She may have been a little uncomfortable, gotten ashen, dropped her blood pressure, and put her back down. So that was prevented. But if she hadn't thrown a clot, nothing much else would have happened. But what if it was a clot? I'm not sure they would have noticed to stop there and at least go into that and check into that and manage that situation before something more catastrophic had happened, to let them know that she was in trouble. So to me also that demonstrated nursing expertise and nursing management of a situation, and nursing ordering and organizing their work. In that room, but then her work for the next several hours looked different from finish with her, then go to the others. It was stabilize, go do some things, get back. Do some things, get back. And experienced nurses just very naturally and with expertise know how to manage that situation.